pleased that people seem to be enjoying themselves, some perhaps without the kind of social distancing that we were hoping for. Physical distancing is required at the moment, and I want to speak a little to that, where we are as a state, where I believe we're going, update you on what's happened over the course of the weekend, specifically about some of the new modifications we've made to our stay-at-home order, and also preview what we'll be doing over the next few weeks. I just want to first acknowledge that we are very close to reaching a milestone in this country: 100,000 lives lost to this pandemic, to COVID-19. In the state of California, we're coming close to 100,000 cases, 100,000 Californians that have tested positive for COVID-19. And while we have fared a lot better than other states as it relates to the mortality, the number of deaths in the state of California as it relates to this pandemic, by no means have we been immune. We have over 3,800 human beings that have lost their lives since the beginning of this pandemic. We lost 19 people in the last 24 hours in the state of California, and we saw a number of new tested positive tests increase by over 2,000 in the last 24 hours here in the state of California. It's a long way of saying we still have a long way of going to get to where we need to be, which is immunity and to a vaccine. And it is incumbent upon all of us to take seriously this moment and to recognize that we are in a transition as it relates to the modifications we've made and others have made all across the United States to the stay-at-home order, and the need for people to be vigilant, arguably now even more than ever. The message in the past was rather straightforward: stay at home. And to the extent you had to go about doing essential business, getting medications and getting food, do so by practicing social distancing, physical distancing, and wear face coverings if at all possible. Now that we have provided the opportunity for more activities, not just again in this state, but all across the nation, we're seeing images on our television screen. We're experiencing things in our own lives that further the cause of vigilance and that require even more of each and every one of us in terms of our individual role and our individual responsibility. As we start to mix with cohorts of people that we haven't been spending a lot of time with, the prospects of an increased number of cases obviously presents itself. The prospect of people transmitting this virulent disease obviously increases. And so incumbent upon all of us to continue to take seriously this moment and continue to practice physical distancing where we must, and to make sure, again, that we are wearing appropriate face coverings if we're going to come into contact with people where we cannot practice physical distancing and social distancing. It's just a reminder to everybody that we're not even out of the first wave of this pandemic. People are talking about the second wave. That's many, many months off. The reality is this pandemic has just begun. It hasn't ended. And while we are moving forward because of stabilization, because of the good work that's been done by health officials all across this nation, all across the state of California, specifically to suppress the spread of this virus, by no stretch of the imagination is this virus behind us. And I just cannot be more, I think, precise in terms of my, recommendation that all of us be sober about the reality of this disease and sober about the reality of lives that have been lost. Again, 100,000 in this nation, over 3,800 in the state of California, 19 new funerals that have to be organized just in the last 24 hours here in the state of California. Concerns always about our seniors. It's just an important statistical point to consider. 19.5% of Californians that have tested positive, just shy of 20% of Californians that have tested positive for COVID-19 are over the age of 65, but 79.2% of them have died. Those deaths, rather, reflected in almost 80% of that cohort of seniors 65 and over. So if you're over the age of 65, I hope you are reminded very soberly of that fundamental and foundational fact that our elderly, those with compromised immune systems, others are in categories of very, very high risk. And as we go about our day-to-day lives, we go back to some semblance of normalcy with modifications, let us not forget the most vulnerable amongst us that are continuing to be vulnerable to this disease and its spread. And so I hope all of us are cautious and are cautioned at this moment as we move forward. And again, the images over the weekend, not surprisingly, with this spectacular weather that we experienced in the state, continue to experiencing with an extended Memorial Day weekend, with the beaches now reopening, parks and other facilities beginning to reopen, or at least opportunities to recreate beginning to reopen. It's just incumbent upon all of us to practice what we preach and to continue to do what we must to keep others safe, not just ourselves safe, and to make sure that we're protecting the most vulnerable Californians. I want folks to know we have been making modifications in real time, not just waiting for noon press conferences. Over the weekend, we made modifications as it relates to retail establishments in the state and places of worship. We allowed for a statewide level the ability for congregants with modifications and limitations to come back into their places of worship. We made modifications on retail, so it's no longer curbside pickup, but now you have the opportunity to go back with physical modifications into retail establishments in the state of California. Those were statewide orders that were put out over the last few days, and you should expect more of those directives and guidelines to be put out over the course of the next few days and over the next few weeks. We made this point earlier. This is a dynamic process, and in this process, it's also iterative, meaning it's one where we're open to argument, we're interested in evidence, we want to see how some of these phased-in approaches go before we make even more meaningful modifications to them. That's why with places of worship, we're limiting to 25% capacity or 100 people, whichever one is lower. I know some people think that's too much, too fast, too soon. Others think, frankly, that didn't go far enough. But suffice it to say, at a statewide level, we now are affording this opportunity, again, with a deep realization of the fact that people will start to mix and be in cohorts of people they haven't been in the past, and that is incumbent upon us to practice that physical distancing within these places of worship and to make sure that we are applying common sense and the rules of engagement that we laid out in our latest guidance. We're one of the few states in the United States to make these meaningful modifications, one of the few in the Western United States. And we are working with our other state partners, looking at best practices from across this country, working through the CDC guidelines and the like. But no, this was the first rollout in this space. And again, we want to be not ideological about how we conduct ourselves in this space. We want to monitor very, very closely and look at the evidence, look at the data to guideline any subsequent modifications of these orders. Accordingly, today we are making some adjustments and announcements related to guidelines on a regional basis. I'll remind you, we have statewide guidance modifications, and we have these variances, these regional variances, which have self-attestations, people basically attesting at the county level, local elected officials and health officials attesting at the local level that they have containment plans and they have plans to protect their citizens from the spread of this virus. 47 counties have self-attested to having those plans of actions in place as it relates to PPE, having the adequate number of testing, ability to cohort individuals that have tested positive or have come into contact with someone who's tested positive, a focus and frame of really beginning to protect the most vulnerable in their counties, be it the skilled nursing facilities, our homeless, those in other congregate facilities, including our corrections facilities. That is part of the attestation process. 47 of the 58 counties currently have self-attested to having those plans of action in place. Along those lines, they will be able to add in barbershops and hair salons to those regional variations starting today. We've put those guidelines out. We put them up on our covid19.ca.gov website, and those counties will begin to allow for those kinds of operations with meaningful modifications, with the appropriate protective gear, particularly face coverings that are so essential in that environment, sanitation requirements, and the like. So giving you a sense that we're making progress, we're moving forward, we're not looking back, but we are walking into the unknown, the untested, literally and figuratively, and we have to be guided by the data that brought us to this place in the first place, and that is guided by these principles of openness and transparency, principles where all of us are required to do a little bit more and a little bit better to make sure we're protecting the spread of this virus, particularly, again, as we meaningfully reopen the economy in the state. So from manufacturing, logistics, warehousing, retail, restaurants, all across the spectrum of our economy, we have made meaningful modifications. Working at the county level, the regional level, we've made even more modifications. We'll be putting out further guidelines tomorrow as it relates to summer camps, a little bit more specificity related to child care facilities, as it relates to schools. We are working with the film industry, television industry. We chose to engage a little bit more formally. We were hoping to put out those guidelines as early as today. We want to extend them to later in the week, perhaps into the weekend, because we're working with both industry and labor, and they want to tighten up some aspects of their guidelines. That's very encouraging and has been a very, very, it's been a very, very positive process. And they're looking, by the way, a process not completely dissimilar to what the grocers did with the industry, which was really, I thought, a model in terms of guidelines for safely reopening. It's a way of suggesting this dynamic process of engagement across the spectrum of businesses and business sectors and across the spectrum regionally all across the state of California. Accordingly, we are advancing conversations with the legislature, in particular supporting efforts to put out guidelines for nail salons and personal care, personal services. Those are still a work in progress, but we have a very good and constructive relationship now that's been formalized with key legislative leaders in the state in that sector. Again, the issues there require, I think, a little bit more specificity, a little bit more nuance and details in terms of the guidance to satisfy our health experts and our, fundamentally the health guidance that is foundational in terms of our efforts. What's also foundational in terms of these efforts is doing our part to make sure we're supporting the counties, supporting cities, and supporting you and this state in terms of getting the appropriate procurement, personal protective gear, making sure that the testing regime continues to improve and increase, and making sure that we have adequate capacity from a supplies perspective beyond just personal protective equipment. That includes ventilators and alternative care sites in this state if we start to see the spread of this disease or see some increases in terms of that spread so we can contain those spreads. And I want to just briefly update you in terms of where we are in that space as well. We have distributed over 41.2 million procedure masks just in the last 14 days in the state of California. Tens of millions of masks are coming in pursuant to a large contract that the state was afforded and many other smaller contracts. We're really starting to turn the page in terms of having the adequate protective gear, particularly on the masks. I've said this before, I'll say it again. The masks are foundational in terms of not only protecting those in the healthcare delivery system, but also to begin to reopen our economy, to get them to the grocers, to get them to our farm workers, to get them to our child care facilities, to get them into sectors so that we can reopen our economy more effectively and more safely. But real progress has been made in that space, and that allows us to make more progress in terms of these statewide modifications to the stay-at-home order. Accordingly, testing has really taken off. We made firm commitments commitments about testing goals, and we've been able to keep to those goals. Over the weekend, we tested 67,000 people. The next day, 61,000 people. Yesterday, we tested a little over 50,000 people. So you can see from 2,000 tests a day, 6-8 weeks ago, now well north of 50,000 tests each and every day. The good news is the positivity rate. That's the number of people tested to the number of people that tested positive holds strong. We're still seeing an increase in total number of people that are testing positive, but again, a huge increase in the overall number of tests, peaking at 67,000 just a few days ago. The positivity rate over a 7 and 14-day period have held very strong. Over a 7-day period at 4.2%, over a 14-day period at 4.1% positivity rates. We want to see those rates in that area of stabilization, that band of stabilization. Ultimately, we want to see them go down, but we are holding steady in that positivity rate, and that's encouraging news as well. Hospitalizations and ICUs, those are the numbers, again, we talk often about. Over a day-to-day period, they went up slightly over the last 24 hours, but hospitalizations continue to remain strongly steady, meaning they're holding, in fact, slightly declining. 14-day average down about 6.7%. But again, stabilization over the course of many, many weeks, well beyond that 14-day period. ICU numbers, stubborn but stable, basically flat over an extended period of time. The good news, though, on ICU side of things is that we have more ICU bed capacity than we have in the past, about 8.5% more than we did a few weeks ago. Ventilators, we have close to 11,000 ventilators that are available just in our hospital system alone. That doesn't include the state's share. So again, all of these numbers are all part of those indicators that have to turn yellow to green so that we could continue to march forward. And indeed, they are turning yellow to green, and we are marching forward as it relates to these modifications to the stay-at-home order. More and more responsibility, more and more accountability now being placed on the counties and their health directors. I want to just thank the county health directors for their extraordinary job in helping advise us, counsel us, and work with us through this process. To local elected officials, some that wanted to move a little bit more aggressively, I want to thank them as well for the seriousness of purpose to which they have engaged. A few exceptions, folks that just want to move on and turn their back to the state, but it's, again, an exception. And I imagine exceptions often become the highlight. But I really want to make this point. That's a very small number of people, communities, businesses that are turning their back to our health officials. The vast majority have been incredibly cooperative. And I just want to acknowledge that and thank each and every one of them, including, by the way, the mayor of Fresno. And forgive me, Mayor Brown, I just wanted to recognize your particular leadership. He highlighted this morning, the mayor did, a concern around cooling centers in this state. Had he not engaged directly, we would not have been able to move forward with some guidance that allows for cooling centers to be open with, again, the appropriate modifications. We're now entering triple-digit temperatures in obviously parts of the Central Valley, even hotter than some of the coastal communities. And I just want to thank the mayor as a proof point for his leadership in the Central Valley, but also for his stewardship, and all the electeds and health directors that have reached out directly and are guiding these decisions. We are not, we don't have exclusivity and insight on every nuance and every detail in a state this large, but we are profoundly influenced by what's happening on the ground in local communities all throughout the state. And again, want to just thank all the local leaders for their outstanding job. And again, want to make the point that we need them more than ever as we move forward into this next iteration, now into phase 3. And the counties counties will have even larger responsibility, health directors, an even larger responsibility to make sure we're moving through phase 3 in a safe and responsible manner. We'll support those efforts, but at the end of the day, I've said it before, localism is determinative. The application of these rules and guidelines will be made real and realized at the local level. And so that's the thrust as we move into phase 3 of where this state is going: more accountability, more responsibility, more flexibility at the local and regional level, and recognizing, again, that one size does not fit all, and they can pace accordingly. And I'll just end on that and open up for questions by making this point. Some parts of this state will not be able to pace as quickly into phase 3, and we continue to be responsive to those concerns and the needs of those local communities to slow down the pace of reopening. And we respect that and certainly will honor that. Others are willing to move a little bit more quickly, and we respect and honor that as well. Again, 47 counties with those attestations that are proof of that recognition as well. So moving broadly in a direction that I believe is hopeful and promising, at the same time sobering in terms of the responsibility that this places on each and every one of us to, again, practice the social distancing and the physical distancing that's required of all of us to protect the most vulnerable in this state, and it will allow us to move more quickly and to this deeper phase 3. Again, phase 4 is about concerts. It's about large festivals. It's about conventions. We are not there yet. That's about fans in stadiums. We are not there yet. And the state will hold the line in terms of those larger venues, but begin, as we do, to push down that responsibility to the counties as we move more rapidly into phase 3 in a thoughtful and phased-in approach. So that's the update for the day. A lot of movement over the course of the last few days through the weekend. A lot of movement to expect and anticipate through this next week, and a lot of progress being made in the spirit of collaboration that defines this moment in our state's history. So again, thank you all the good work of our team, and Sonia Angel and Mark Galley, and all the outstanding leaders in our Department of Public Health, again, and all the health directors at the local level and local elected officials. Thank you for your guidance. Thank you for your counsel as well as we move through this next phase together. With that, happy to take any questions.
Jeremy White, Politico.
Hey, Governor. Thanks so much for taking my question. Over the last week, we have seen the Department of Justice reach out to both the state of California and Los Angeles itself, expressing concerns about various restrictions still in place. I know the limit on church gatherings you've obviously acted on, but more generally, are you concerned about the federal government taking a more assertive stance towards California's restrictions, and do you see the potential for a legal clash down the line?
I don't. I don't lose sleep over that. Maybe it's the fact that this is California. We're involved in over 70 lawsuits with the administration. Predates my time as governor, many of those lawsuits. So none of this surprises me at all. Doesn't surprise you, I imagine. And again, we're entering into a political season. And so I can only anticipate we'll see more. But again, we're working very collaboratively, not only regionally, but with the federal government on things that really matter. Some of these other things, to me, it's just noise.
Dave Lopez, CBS LA.
Yes, good afternoon, Governor. Two quick questions, if I may. The LA County Board of Supervisors just appointed an inspector general to take a look at the problem in the assisted living homes. Does that continue to be a major concern for you throughout the state? And my second question is, you looked around and saw all the people enjoying themselves. Are you worried that perhaps there may be a spike and all of your plans of moving forward will have to take a back seat at some point?
Yeah, no, both very thoughtful questions and appropriate questions to this moment. Both things are of top concern. that we go back to some sense of normalcy with amnesia, that we forget the past, we forget the fact that we're meeting a mark of shame in this country, that 100,000 souls have lost their lives, that this pandemic continues, that we're seeing positive number of cases increase, not decrease, even though we're seeing stability here in the state of California and positivity rates holding strong. That doesn't mean we're out of this thing's behind us and that we're out of the woods yet, and quite the contrary. What has made the difference, we believe, in the state of California was moving swiftly and acting with a sense of urgency on our stay-at-home order and people practicing physical distancing, social distancing.
You've been watching Governor Newsom's update on the coronavirus in California. To keep watching live, you can head to CBSN Bay Area, but the governor announcing today that we're moving into phase 3 now in certain parts of the state, saying starting today, hair salons and barbershops in counties that have already been pre-approved for an accelerated reopening can actually start opening again. That's starting today. Now, of course, he's putting a lot of responsibility on local governments, saying if that county or region is not ready for an accelerated reopening, then they can pull back the reins a bit and become more restrictive.